everyone. My name is Jason Rogers. I will be the moderator and host of today's call. I would like to call this meeting to order and inform you that this meeting is being recorded. Should anyone have an objection to being recorded, you may disconnect now. This teleconference meeting will be run by the agenda and all attendees will be placed on mute so the primary presentation may be proceeded uninterrupted. All questions during the teleconference should be emailed to ema@co.delaware.in.us so they may be addressed at the end of the meeting. That email is included in the invitation. Please do not place your phone on hold as hold messages will play to the group. When and if this conference is unmuted, please keep all side conversations to a whisper and background noise to a minimum as it will be audible to the entire group. Welcome everybody. My name is Jason Rogers. I am supposed to be being joined with Jamie Bain, but we've had some late breaking information, so I'm not sure Jamie will be joining us quite yet today. We're going to go through each topic. I do have the agenda and I'll make it available to you after this is all done through email. Topic A is Delaware County Commissioners and the Mayor of Muncie have signed a local disaster declaration. They are also implementing limited government building hours for the public beginning 3/19, and further restrictions will be taking effect, we believe, in the very, very near future. Topic B, the county EOC remains activated at level 3 and a COVID-19 hub has been placed at www.dcema.com with local flu tracking and media information at that website. Please, also I want to notify you, myself, that we do have our first lab confirmed positive test for the coronavirus in Delaware County, and that press release has gone out just a few minutes ago. Item C, at this time, Delaware County will not be using the travel advisory system mapping to try to keep the public off the streets. We believe it is confusing to the public, and several businesses have contacted the EOC concerned about their ability to do business in Delaware County. We typically use that for snowstorms and ice storms, and we don't want to confuse the message that we have been consistently sending. Item D, there is a blood shortage. We have been in contact with the American Red Cross and have asked us to suggest to coordinate places for blood drives. We are doing that currently. There are also partners in the community that are suggesting Ivy Tech, the Fisher Building, the Suzanne Grisham Center, several gymnasiums, the old Marsh Building on Jackson. They also indicated that there is a need for a spot for at least half the size of a gymnasium for this operation, and there are additional protocols in place for social distancing. We're also discussing the possibility of a drive-through blood donation clinic. The state medical director put out yesterday that this is not a bloodborne illness, and they are down almost 50,000 blood donations. So it is something that is certainly being addressed, and we're trying to make this as easy as possible for blood donations. This is a moving target and an invisible target, so it is a little bit out of the box for everybody at this point. Topic E, the homeless population. We have information from all of the homeless shelters in our community. In the last 3 days, what we know is that they are all handling things just a little bit different. Our understanding is that full service, non-essential shelters are required to stay open. Collectively, they are housing about 130 people, 130 homeless at this time. Item F, directives for nursing homes and hospitals to follow the CMS guidelines, including visitation restrictions, are now in place, and we would ask that all non-essential personnel, all non-essential procedures are terminated at this time. Hospitals and ambulatory surgical centers should cancel or postpone elective or non-urgent surgical procedures immediately. Physicians should continue to perform critical procedures necessary to prevent short and or long-term adverse effects to their patients' overall health. So we're not saying don't provide health care. We know that that is a necessity. We have the governor has closed bars, nightclubs, and restaurants. They are required to stop all dine-in services, and but they may provide takeout and delivery services through the end of March. We know that we have that in place locally, and we will follow the governor's directive on that as well. All businesses that are transitioning to curbside service will all be able to be kept open. Item I, monitoring the critical state and local resources through EM Resource, including personal protective equipment, viral media, testing supplies, bed availability, and all of those items are being tracked by the Indiana Department of Health on a web source called EM Resource. If you need more information about EM Resource, please send an email to the EMA address and we will get you information on that. Topic J, the Indiana Department State of Health has activated a 24/7 call center. The new toll-free phone number for that call center is 877-826-0011. This is the Indiana State Department of Health, and it is open to the public and or medical providers to answer questions about COVID-19. Topic K, current testing availability, the ISDH laboratory testing criteria for high risk and severely ill patients is what we are under because testing is limited at this time. We expect results within 24 hours when tests are conducted. Presidential directives have indicated that any test must be communicated to the State Department of Health, ISDH, immediately upon finding a test positive. So they are tracking those. If they are using a private laboratory, and locally we use LabCorp, we expect results in 3 to 4 days because they have to ship that out. There's also a critical shortage of testing equipment. Topic L, 554 Hoosiers have been tested as of today, not including today's patients that were tested, and ISDH is currently testing high risk and severely ill patients only. I'll give you an example. I'll give you examples of such. Patients requiring hospitalization with a fever and or low respiratory symptoms, negative for other sources of infection. Healthcare workers, inpatient, outpatient, nursing home, and other long-term care facilities are all being tested so that if they come back negative, they can get back to work. If they provide direct care to the at-risk patients. Long-term care facility residents, prisoners in the jail, residents and staff at the jail with fever and respiratory illness with no known otherwise source will also be tested. Topic M, there is a national shortage of personal protective equipment, specifically face mask and N95 mask. The state has put out guidance to follow for personal protective equipment conservation recommendations and optimizing your organization's supply in the event of shortages. We are asking currently industry, construction, and others to donate any supplies of N95 masks to medical and emergency services providers through the Emergency Management Agency. So if you have those connections and they do have a large supply of N95 masks, please reach out to that email that we have provided. We now have some time for Q&A. When this conference is unmuted, please keep all side conversations to a whisper and background noise to a minimum if possible, as it will be audible to the entire group. Should you wish to speak, please state your name and whom you represent. Please do not place your phone on hold, as a hold message will play to the group. I'll now open it for questions and answers, and I will review back to the email. Okay, I've allowed you to unmute yourselves. So if you already are unmuted, or you may choose to unmute now if you have a question. And I'm checking the email. I have one question. This question is about the missions, following the best information available provided by the Federal Homeless Council and protocol sharing with over 300 missions from the United States. We're open and prepared. And looking for local contact reporting protocol in the event of a virus. That's Frank Baldwin from the Muncie Mission. Frank, we will respond to that email and get you your contact information. I've got a question from Steve Lindell. Can you suggest how those on this call will deal with rumors? I am sure that some or all have heard several of those, and we need to help the public stay calm. I absolutely agree with that. We are trying to put out a unified message every day from the EOC via our social media and the YouTube channel. We are starting to see fake text messages, emails, and phone calls for disaster relief, different groups that are trying to fraud people out of money. So be very cognizant about that. Please only allow your people to, or please put the information out only to donate to reputable local charities that we know. Also, there is an email going around about a federal lockdown, a quarantine notice, and that is a false flag, we believe. That email was, or I'm sorry, that text message was simultaneously received not only by one of our EOC staff yesterday evening, but also my sister, who is in California. They received the exact same verbiage within 30 minutes of each other. So we believe that is also a false flag. Are there any other questions?
Jason, this is Dr. Donna Wilkins. We just need to inform the public that they still need to try to keep the 6-foot social distancing in effect, whether they're at the grocery store, at a bakery, at a meat market, whatever. That's important to continue to do that for the businesses that are still open.
Thank you, Dr. Wilkins. That is exactly right. I just received another question from County Council member Scott Alexander. He said, with one confirmed case, are there any areas of the county to avoid? We don't know where the case was contracted in the county or the city. We're not able to release that information because it is a HIPAA violation. So the social distancing is so important. I also know that we're not necessarily have that information provided to us at the EOC. So we are just maintaining our operational awareness because almost every county around us has either already reported or we anticipate will be reporting. From the police chief of City of Muncie, Nathan Sloan, we heard 3M and some other companies are putting out mass volumes of masks. Is there a process to get those to first responders? We have some masks, but obviously supplies are limited. Yes, Chief, we have sent that ask up to the strategic national stockpile. We believe we're going to get an answer on that pretty soon, maybe even yet today. So we will be able to disseminate that information as soon as possible. I will be sending out to all public safety personnel a query for you to tell us what your needs are. And if you will just be looking for that email here in the next probably 12 hours so you can take inventory of that so we can get it back pushed out to the state. We have already reported that we are in emergency need, and they have identified counties as green, yellow, and red. We have identified our county as red, as not having a cache of supply for N95 masks. So I hope that answers your question. This is from Roanna Ball State. Does this apply to Ball State University? Yes, it does. Steve Lindell, what time will the briefings be during the weekend, and are there any on this call allowed or invited? So this call I sent out to as many community leaders as I could. We have room for 200 callers. It looks like we have about 40 on here right now. We will continue these calls Monday, Wednesday, and Friday. At this point, I will also suggest for you to follow along from our Nixle. You can receive the text alerts or the email alerts by going to dcema.com and sign up for emergency alerting. The other option is if you would like to receive the text alert, you can text the letters DCEMA to the number 888-777. It would also, Steve asked also, would it be helpful for the media to use the phrase "do not panic" or something similar? What would be appropriate? Yes, that would very much be appropriate. I've got a question from Tim Brown, superintendent of Cowan Schools. Doesn't want to play the what if game, but if Delaware County could be given an order to limit travel to emergency personnel only, do you see any situation where it would have to cancel school food distributions? We will not be giving that order. There will not be, because we know that there are dire needs for food distribution and other critical infrastructure needs. We will not be giving that restrictive order, and I have no plans at this time to restrict travel using the travel map as you all know it for snow and ice emergencies. Okay, I don't have any more questions. Does anybody have anything on the call specifically? Okay, I'm going into the chat here. We've got a couple more pieces. Somebody had something. Go ahead.
I was just going to say thank you for everything you've done. This is Kay Walker, the Center Township trustee.
Hi, Kay. Thank you very much. Trying to get all the information we can out, and I'm going to be honest with you folks. I so much appreciate your leadership in the community and your supporting the Emergency Management Operations Center. We couldn't do and would not be successful without all of your help. So please include your executive level people on this call. Obviously, we only have so much room, so we want to make sure that we get all the important people. I know I missed somebody in this email. I will send out emails to use this call also those 3 days a week, and I will have an update and Jamie here to answer more specific questions. If Steve Lindell sent a question, if there are donations of N95 masks are to be donated, where to deliver them? So what they need to do is call the emergency management office, and we will have somebody pick them up. The number of the emergency management office, which it will be open during business hours for this type of service, is 747-7719. 747-7719. If any of you have any needs, please feel free to call that number 24/7. We do have an answering service. If it is an emergency, you can call the Delaware County Sheriff's Dispatch and have somebody contacted. Many of you have my cell phone number, and you may share it amongst yourselves if it's an emergency. But I will warn you this: everybody and their brother, plus all my wife's friends, are calling. So I've had to limit what I can answer and what I've not. I have another question from Scott Alexander. Those that want to help, where can we find information? Where is the need at this point? Currently, we are taking volunteers online at dcema.com. If you go to the Coronavirus Hub, you can sign up to volunteer to be part of our food distribution. That was the other piece that I didn't have written on a note here, and I didn't have it in the agenda, but we are doing a food giveaway starting tomorrow with the Second Harvest Food Bank at 10 o'clock in the morning at the parking lot of Delta High School. Then we will be doing another one at the Muncie Mall on Thursday. We plan to do one or two of those food giveaways around the city and county, north, central, and south, at least 2 to 3 weeks, as long as Second Harvest Food Bank can continue to support us. So we're asking for volunteers because those volunteers are critical to make those points of distribution available to the community. So I think in one day we've fostered about 75 volunteers. It takes between 15 and 20 to set up a pod. We have also established a pod manager here at the EOC. His name is Jeff Lacey. He is a retired Muncie police officer who's volunteering his time to help So if you are interested in donating, volunteering to be part of the pod, or you know somebody, or you know a group that's willing to volunteer for the pod, please go to dcema.com, click on the Coronavirus Hub, and find the volunteer link, and you can sign up. I had a question from Ball State again. If an individual tests positive, are contacts notified, and by whom? The individual themselves is contacted, then the physician and lab are required to notify the State Department of Health. State Department of Health notifies our health department, and then they have follow-up. So we do have illness and virus nurses that will be following up, monitoring those patients.
Jason, can I ask you a question?
Yes, who am I speaking to?
Jimmy Duckman at Ball State. You referenced
Yes, sir.
a new order coming out with restrictions. Do you have a time frame when that may be released and what they mean?
I do not. It's in the hands of the commissioners and the attorneys now. I hate to say that I don't know, Chief. That's something that I had to stop another phone conference to start this one, because I wanted to make sure everybody here was briefed. So I don't have information, but we will push that out through our Nixle alerting as soon as we know something else.
Thank you.
You're welcome. Samantha Buckles asked, being a homeless service provider, how do we get a hold of rubber gloves to clean the showers at our organization for multiple showers that are taken daily? Please send that request to the ema@co.delaware.in.us. And any request like that, if you have a request for personal protective equipment, you need cleaning supplies, you need anything, just please, we will push the ask up to the state EOC, and we will try to find those resources here locally. We have been alerted by FEMA Region 5, which is the Chicago office, and our central region advisory point, to source our own equipment as much as possible. This is a national shortage. The national strategic stockpile is being allocated, but the problem is every community and every town and every county is suffering from this same thing. We are FEMA and emergency management routinely trained for these types of things, and this is not your garden variety hurricane. So it's not just one section of the country and we can call the cavalry from another section. So this is unprecedented, and we're dealing with it as much as we possibly can. So please send in your emails to the EMA email account, and we will get back with you on that account and push that need or request to the proper authority.
Jason?
Yes, sir.
Ball, just wanted to make sure everybody on the call, if they know people dealing with hunger, that we are serving Monday through Saturday, 6 o'clock, hot meals, and tomorrow on Saturday we will do a food distribution with Second Harvest supplies as well, same time, 4 to 5.
Excellent. Thank you, Bob. Jessica Piper has asked me, what can all of us do on the call to help me personally? And thank you for all that you do. Thank you, Jessica. Just maintain operational awareness. Please spread the word for our text alerting. Get your key leadership on this call with us Monday, Wednesday, and Friday at 4:30, and just maintain that information ebb and flow with the Emergency Operations Center. We are closed to the public. I know we turned some people away, but we have to maintain the cleanliness here in the shelter, or in the center, because it is our 911 service and PSAP. So we're doing everything that we can to maintain the health and safety of our staff here. So please use the email and reach out to us and communicate all of the things that we have passed on today to your staff, friends, coworkers, and family.
Helping you feel empowered and prepared. So let's take it to we'll get through this.
So one other point that I didn't have on the agenda that I do want to bring up, there was a national disaster declaration signed by President Trump, and he did include the Stafford Act with regard to that. So those of you that are responding to this, You are going to have to start tracking all of your expenditures, both in and out, all receipts, all time, everything that you can track. If you plan and intend on applying for disaster relief funds through the Stafford Act, we are going to have to collect that at some point. So the best thing that you can do is maintain your records, start collecting that data, and as much data as you can. Is never enough when we sit down to do the request for FEMA funds. So please track that as well. I got a message from William Gossett, IU Ball. He would like me to reference back to the IU virtual clinic. Again, that is what we are saying. We are also following the guidance from the Indiana State Department of Health and the Indiana EMS medical director with regards to medical staff getting sick. If you feel that you have symptoms, please use the virtual clinic. And those of you or your employees or your friends or family that would be needed to be tested critically will hit all the markers, and the IU virtual clinic is the best place to go. If you have these symptoms and you're not deathly ill, we really are want you to use the virtual clinic if you can. The hospital is doing their best right now with all of the patients that are being seen, but every single hospital is under the same situation. So we want to make sure that we're using all of our sources appropriately. Amanda Dunnick had just asked me, can I email the agenda so when passing the message along, will be less chance of repeating it wrong? Yes, I will send out everybody that got the invitation to this meeting. I will send you out an email. They will be numbered, dated, and so forth, so you can see all of the points. I will try to go back. Also, this is being recorded, and I don't know how to do it yet, but we're going to get it figured out to where we can send out the recording as well. Samantha is asking for the EMA email again. Yes, it is EMA at CO for county. So co.delaware.in for Indiana.us. So EMA at co.delaware.in.us.
20 years old. I got sober, and I'm sitting here 20
Jason,
Yes.
it's Kay again. Do we anticipate any more closings right away?
I anticipate more closings. I don't know how quickly they will come.
Thank you.
We will bring coaching resources.
The quickest way for everybody to get that when and if those closings come will be through our Nixle alerting.
I do know it. And I will stand up for you.
Okay, we are right at 5 o'clock. I want to keep these to a half hour because I don't want to waste anyone's time. If I did not get to a question or I missed something, please send me the email at ema@co.delaware.in.us or my email for the time being, since this is our first call. This is the first time that we have utilized this GoToMeeting platform. We bought it last Friday, and so far so good. We're using it about 3 times a day so we can do virtual meetings, and so we will get better at this. If any of you had any difficulty getting on, I want to thank you for your time and your leadership to this community, and I look forward to having this call again on Monday at 4:30. I'm going to disconnect and stop recording at this time. Thank you for joining me.